Good day and welcome to today's American Lung Association webcast, Nationwide Radon Webinar for Real Estate Professionals. Before we begin, as a reminder, on the left-hand side of their screen, there are multiple application widgets you can use. All of the boxes are resizable and movable, so feel free to move them around to get the most out of your desktop space. For the best viewing experience, we recommend using a wired internet connection and closing any programs or browsing sessions running in the background that could cause issues. If you have any technical difficulties during the webcast, please let us know via the Q&A box. If you have any questions for the presenters during the webcast, you can submit them through the Q&A box. And now we'll begin the webcast, and I'll turn it over to Catherine Pruitt with the American Lung Association.
Thank you, Bailey. And welcome everyone to the nationwide Radon webinar for real estate professionals. We thank you for joining us today. I think we have a wonderful program planned for you. My name is Catherine Pruitt. I'm the National Senior Director for Policy with the American Lung Association, and I'll be moderating today's session. The American Lung Association is the leading organization working to save lives by improving lung health and preventing lung disease through research, education, and advocacy. Our programs, initiatives, and events help millions of Americans every day, and you can see more about how our efforts make a difference for lung health at lung.org. January is National Radon Action Month. The aim of National Radon Action Month is to increase the public's awareness of radon and promote radon testing and mitigation. The real estate transaction is what we call a teachable moment for radon awareness, and real estate professionals can play a very important role in spreading word about radon in your communities. Thank you for taking the time to learn more about radon today and what you can do in your communities. This event would not have been made possible without the support of the U.S. Environmental Protection Agency under Assistance Agreement 839-24601. The contents of this program do not necessarily reflect the views of the EPA. Also, please note that this webinar is being recorded, and a link to the recording will be sent to everyone who's registered for this event. By the end of today's webinar, we hope that all of our participants will go away with these three having achieved these three objectives. We want you to understand the importance of radon testing and mitigation, to learn some tips about how to talk about radon with home buyers and sellers, and to identify ways to incorporate radon awareness into your practice. To get those learning objectives through, we have arranged our agenda in the following sections. First, we'll talk a little bit about the importance of radon awareness, go over some basic facts about radon, so share some guidance for working with home buyers and sellers, and some next steps for what you specifically can do in your communities to advance radon awareness. We will also end the presentation with some time for questions and answers. You're welcome to put the questions in the question box, which you'll find down the bottom left-hand corner of your screen, at any time they occur to you as we go along, and we'll do our best to get to as many of them as we can at the end of the program. In order to achieve, I got a little behind. Since this webinar is offered nationwide and continuing education credits vary by state and by profession, we're providing a general certificate of attendance to those that complete the live webinar and the evaluation at the end of the program. You're welcome to check in with your local associations to see if they'll accept this certificate of attendance toward education credits in your profession. The certificates of attendance will be sent via email within 1 to 2 weeks after the webinar. And remember that only those that complete the evaluation at the end of the program will receive a certificate. Before I introduce our speakers, I'm going to present our first polling question of the day. We'd love to know more about our audience. So if you can tell us, sorry, if you want to Please complete the polling questions and let us know what profession you most closely identify with. Give you a minute to do that. Okay, shall we view the results? Okay, we have almost 40% of you are real estate agents, followed by home inspectors. No, there are a lot of other radon professionals. What a wonderful, diverse group. Look forward to sharing with all of you, and let's move on. Thank you. Okay. Now my pleasure to introduce our speakers for this webinar. We'll first hear from Lindy Campbell, who is a lung cancer patient and advocate. Lindy will be sharing her journey and reminding us how important it is to promote radon awareness in the community. Lindy has made it her mission to erase the stigma around lung cancer by educating others that anyone with lungs can get lung cancer. She believes it's urgent that we improve and expand our conversations to include discussions of various causes and factors surrounding the disease, in addition to tobacco use. Lindy spends much of her time working with organizations dedicated to scientific research focused on improving the survival statistics of lung cancer for all. Aside from her ongoing work in lung cancer advocacy and her nonprofit organization, Lindy also works alongside her husband at their CPA firm, Campbell and Company. Our second speaker is William J. Angel, who will be presenting on the facts about radon. Professor Angel is a professor emeritus of housing at the University of Minnesota, where he served 30 years as director of the Midwest University's Radon Consortium, a U.S. Environmental Protection Agency-supported regional radon training center. He chaired the Prevention and Mitigation Working Group of the World Health Organization's International Radon Project, where he co-edited the WHO Handbook on Indoor Radon, a Public Health Perspective. He's also past president of the American Association of Radon Scientists and Technologists and an active member of multiple ARST/American National Standards Institute standards development work groups on radon measurement and control in low-rise residential buildings, multifamily buildings, and schools and large buildings. He chairs the Radon Control in New Construction Work Group. Professor Angel also serves as Cancer Survivors Against Radon, CANSAR's board chair. Our third speaker is Stacy Durbin, who will be presenting on guidance when talking to home buyers and sellers. Stacy is the general manager of Semonin Realtors, the largest real estate brokerage in the greater Louisville, Kentucky region, with services expanding into southern Indiana and Elizabethtown and Fort Knox markets. Stacy entered the real estate industry in 2004. Her passion for serving people and creative marketing strategies helped her quickly rise to success in her career. In 2015, Stacy took on the role of sales manager, leading a team of 80 Semonin agents, an endeavor that ultimately led her to where she is now as the general manager. In her now nearly 20-year-long tenure with Semonin, Stacy developed a strong love for the real estate industry, the Semonin brand, and the career and relationships it has allowed her to build. Many thanks to all three of our speakers for taking the time to present on this important topic today. I'm now going to turn it over to Lindy Campbell, who's going to share her personal story and why it's so important that we all do what we can to increase radon awareness and risk reduction in our communities. Lindy?
Thank you. I appreciate you having me here today, and I'm just so excited that we have such a good audience, and really appreciate everybody's time. I hope when I'm speaking today, you'll not only listen to my story, but you'll also hear my message. There are very few ways to prevent lung cancer, but testing and reducing radon exposure is a way to help prevent damage to the lungs that can turn into cancer. I wish I'd known growing up what experts now know. The science is there, The statistics are there. Now let's work to do more to make radon testing and mitigation an important part of saving the lives of those around us. Our citizens and homeowners need your help making sure every house is tested for radon before it's purchased. I've never known of a time in my life when I wasn't active. It's always been important to me to make sure I take care of myself. In fact, until my lung cancer diagnosis, I never really imagined myself as someone who could get cancer. There's no history of breast cancer in my family, and I somehow felt my eating and exercise habits kept the odds of never getting cancer in my favor. I always loved anything cardio related. As an A-type personality, I thrived on it. I never in a million years would have thought or have wanted my lungs to be the place I would get cancer. I was leading a great life. I was happy, healthy. My kids were grown and doing great, and my husband and I had just celebrated 30 years of marriage. In many ways, I would say it's the healthiest I've ever felt. I'm sorry. So there was my second slide. Now let me get back on track. Okay. In August of 2015, at the age of 51, doctors began watching a small spot on my right lung. It appeared incidentally on the chest x-ray. For over 2 years, it was perceived as nothing too concerning, since I was not someone who was considered high risk for getting lung cancer. After seeking a third option from a local pulmonologist, he suggested that I have it removed because it was continuing to grow. These photos were taken the morning after learning I had lung cancer, and the surgeon had to remove 2 lobes of my right lung to give us the best chances for the cancer not to return. I like to reference the look on my husband's face in this picture because while I know he was trying to be strong for me, he was terrified on the inside. The uncertainty you're now forced to live with for the rest of your life can weigh on family members greatly. And unfortunately, when it comes to lung cancer, it's not just about the number of deaths this disease causes, but it's also about the greater number of grieving family members it leaves in its path. In this moment, we had not yet fully processed the diagnosis and the uncertainty of my future, or the blindsided nature in which this disease hit our family. It leaves a ripple effect that stays with you forever. I was born in the mid-60s. I'm the youngest sibling pictured here. Growing up back then, no one talked or knew much about the dangers of smoking. My parents and my siblings had no real understanding of how this habit could impact the future of their health or those around them. In fact, you could smoke just about anywhere. As far as radon was concerned, it was never talked about. There were 9 members who spent time living in my childhood home, and only 2 of us never smoked. I'm the youngest in my family. I never smoked, and I'm the only one who got lung cancer. I tell you this for one simple reason, to make the point very clear that smoking is not the only cause of lung cancer. This is my childhood home. It's a ranch on a basement. It was built in 1965, and my 85-year-old mother still lives there today. When I was growing up in the 60s and 70s, if houses had basements, they were usually unfinished, and you rarely spent time in them. In our house, it was different. We had a very large family, so we had to make use of all the space in the house. When we were younger, we would roller skate down there. Several of my sisters shared a bedroom down there. And for most of my years growing up, we had a small den area where we would spend lots of time watching TV. By the time I was 13 years old and the house was empty, all of my siblings were gone, I was excited to make the basement bedroom mine. When I was diagnosed with lung cancer, we tested that basement bedroom and learned the level was 3.8 picocuries. I would sleep at night in the bedroom, and during the day, I'd go upstairs to secondhand smoke. For 20 years of my life, my lungs were exposed to both radon gas and secondhand smoke. Most may tend to blame secondhand smoke, but statistics tell us that many more people die of lung cancer from radon exposure than secondhand smoke. I just happen to live and breathe both. I think about how times are different now, and while it was rare for me to have spent much time in my basement growing up, people today often spend as much time in their basements as they do in other parts of their house, thus making the need for radon testing even greater. I would assume most, if not all of you tuning in today know about radon. Many of you may even understand the science and statistics behind it. But do any of you really know the impact it can have on the health of unsuspecting homeowners? I mean, really know? Because unless you intimately understand that piece of what we're talking about today, the subject of radon will always simply be just another part of your job, a line item on some paperwork, and in some cases, just one more thorn in a realtor's side when it comes to closing the deal on a house. I don't say this with any sort of blame, just like I don't blame any of my family members for exposing me to secondhand smoke. They didn't know. It was never their intention to harm the people around them, and I don't believe that's your intention either. But let me ask you this. If I was your mother, your sister, your wife, your daughter, your friend, or yes, even you, would you feel differently about radon exposure and lung cancer? I hope you now understand my journey and story is proof that all you need are lungs to get lung cancer. But this isn't just about my story. I know stories of hundreds more people across the country just like me who got lung cancer and never smoked. Pictured here are a handful of the families I've met who are either from my home state of Kentucky or live here currently. Almost all of them had no previous smoking history, and all but two in this photo were diagnosed at stage 4 when the disease had already spread to other parts of their body. 3 women in this photo are young moms who were diagnosed with lung cancer at stage 4 in their late 20s. Many have patients who are diagnosed with lung cancer, have no way of tracking back to find out if they were ever exposed. So the statistics of radon and lung cancer are likely much higher than we might think. I have 2 very close friends I met as a result of my advocacy who have grown up and still live in Kentucky. Both Leah and Chastity were in their early 40s when they were diagnosed with stage 4 lung cancer. Both are married and moms to 3 children. They also have a known history of radon exposure. Leah attended and later taught in that same school she attended as a student. And after she was diagnosed with lung cancer, she learned that at some point after she no longer taught there, the school tested extremely high for radon. She never knew all those years when she was in a building she perceived to be safe that it was causing damage to her lungs. Chastity had her home tested for radon after her diagnosis, and the level was 8 picocuries, twice the level considered to be a health risk. We all share a bond no one would wish to share, but we're thankful to have each other to walk through this difficult journey. Thanks for your time, and I look forward to joining you again at the closing of today's webinar with some final thoughts.
Hi, my name's Bill Angel, and Lindy, thank you very much. Lindy's statements are so incredibly powerful, and it's the voice of Lindy and others, unfortunately, that have experienced lung cancer that really underscore the importance of this topic today in our discussion about ways to further testing and radon control when that's needed. And we will learn it will not be a major disruption in real estate. So we're all in the same boat together. I'll just say personally, as a follow-up to what Lindy said, I have 2 relatives or had 2 relatives that I lost to lung cancer, neither of whom that smoked. One was a 38-year-old brother-in-law. He was an MD. He was the fittest guy in the world. And that was long before we knew about radon, at least widely. The second was a mother-in-law who I lost at 62, who never smoked as well. And unfortunately, who do not have access to some of her homes that go back to Turkey, actually, and to know what her radon exposure was. But there's many people that walked, unfortunately, the walk that Lindy walked and her two friends that she referenced. Let's go ahead and take a look at some dimensions about radon. First of all, a question for you, and that is, how do you rate your knowledge about radon? And I'll give you a moment. And I'm not seeing results on my screen.
Sure, I can read them, please.
Okay, they refresh. So basically, the distribution I see is the largest share of the respondents are not very knowledgeable, or there's another group very knowledgeable, so more in the center. So let's go ahead, and we've heard from 24, and there's many more that have not answered yet. So that's fine. Let's see what we can learn. Some of the facts about radon, excuse me, are number one, it's a radioactive gas, and in our environment, and that's the environment that we share outdoors, radon is definitely naturally occurring. Indoors, it's really influenced a lot by the types of buildings we live in and what we do within those, including heating them at this time of the year. It's part of the uranium decay chain. And so radon is a decay product of uranium. It's colorless, tasteless, and odorless, and the significance of that is we need to figure out different ways to measure it. And fortunately, there's been technology around for more than 30 years of how we can measure it, and well-established technology, I'll add. Indoors, radon is on the average in our homes 3 times higher than in the outdoor environment, but it can be hundreds of times higher as well. And the only way to know is by testing. And that's one of the keys. You cannot depend on what the radon concentrations are in the house next door or the apartment or condo next door. The only way to know what the exposure is in any home is to test in that home. And I may add that any home should be retested every 5 years. That's the current national recommendation because radon concentrations can change. Well, where does it come from? Well, of course, the primary product or the primary source of radon in our homes, schools, and other buildings is the soil and the geology that underlies our homes, what our homes are built on. And also, it's influenced by the type of construction that we have and and what we do within. And in the illustration that you have, you see upward arrows. The physical driving forces are primarily because of two factors. The largest one is because of subtle air pressure differences from between the home and the soil. And air always moves from high pressure to low, which means indoors we're at a lower air pressure than the soil. And that's going to be important later on when we look at radon control methods. Another way radon moves from the soil to the indoors is by diffusion or due to concentration differences. And that's always a movement from high concentration to low concentration. As I said earlier, radon in our homes can vary indefinitely from house to house, apartment to apartment, condo to condo. And the only way to know what the radon concentrations are to test. Radon in homes is responsible for over 21,000 lung cancer deaths per year. And that figure is based upon an analysis that is more than 20 years old today. And because of changes in construction practices and air tightening we've done for energy conservation purposes, that figure is higher today than it was 20 years ago. In addition to the 21,000 deaths from radon in homes, we have radon exposure in schools, classrooms, child care facilities, offices, and so on. So actually, radon is responsible for more than 21,000 lung cancer deaths per year. And as Lindy mentioned, it's the second leading cause of lung cancer, following that of smoking. Among never smokers, it's the leading cause. And from a health standpoint, lung cancer is the most strongly documented risk with radon exposure. There's possibilities of other forms, some other health impacts beyond lung cancer, one of which, although not as black and white as lung cancer, is some forms of leukemia. And definitely, if you have smoked or you're currently smoking, your risk is accelerated from a never smoker. This is a critical question that I think we all need to ask ourselves. And that is, have you tested your own home for radon? Would you please answer one of these questions? And the results that I am seeing, half of this audience has, so maybe a little bit we're preaching to the choir here, but a significant share have not. And it's vitally important that each one of us tests our home for radon. And if you want to have even more fun, do an outdoor measurement next to your home. Protect the radon measurement device from precipitation, but you can measure outdoors as well. And there's ways to test the soil if you're curious about that. But the most important is clearly within your home. So please test your home and plan to retest every 5 years later. And again, the only way to know what your radon exposure is to test. Now, this little chart that we have on the screen, there's a center element here that I have circled to pop it out, because I don't expect you necessarily to be able to read all the lines. If you look at the chart and can see it, let me tell you the general trends that it represents. Number one, there's no safe level of radon. Number two, the more you're exposed to.
Bill, you need to advance your slide, please.
I have radon testing. Is that what we have? Yes, we do.
It's not live yet.
You may just need to hit push to audience.
I did. Okay, thank you. All right, I can see it better, so I hope everyone else can. But the trends, once again, in the small chart that's on the right of the slide, is there's no safe amount of radon. That's number one. Number two, the more you're exposed to, the greater the risk. Number three, which you don't see in this chart because this is all lifetime, the longer you're exposed, the greater the risk. And number 4, if you have smoked, the greater the risk. And then you look at, I want to point out the line 4 picocuries per liter. And uh, actually, I'm going to talk about per thousand, so it's easier for me to understand that. And you see overall, for the overall population, the lung cancer death risk at 4 picocuries per liter, and that's our action level, is 1 out of 50. That is an insane risk in the world of environmental risk. And if you smoke, it's a multiple of that. If you've never smoked, it's about 1/3 that. But it's an insane risk, and it's easily preventable if we test and control our levels. And I'll also say what we've noted in the slide, EPA has an action level of 4 picocuries per liter. But do you know where that originates? It originates from the essence of Superfund technology of the early 1970s. It's not a health-based risk standard. WHO, in looking at all the risk evidence up to about 10 years ago, and as mentioned, I was on that work group, the International Radon Project, said that for developed countries, an action level of 2.7 is justified. That's 1/3 less than US EPA's. And so I'd encourage you to think about that, again, recognizing because there's no safe amount. And we measure in units called pico or picocuries per liter. Either pronunciation is fine. Radon mitigation is very simple in concept, and it's usually relatively simple in terms of installation. The simple concept is we reverse with a fan, we reverse the pressure relationship between the soil and the indoors. We do that by creating a vacuum on the soil underneath the building. And that's the major way that we reduce radon. And we can reduce radon entry as much as 99%. And it's not any more complicated than that. The cost will depend upon the nature of the home and some of the challenges that you have, but usually the cost is somewhat similar to that of replacing professionally a water heater. So it's not out of the ordinary. Now, when we look at possible policy changes that are important and have important impacts, some of the most successful have been done where there's been mandatory disclosure of radon concentration at the point of sale with a strong testing recommendation. And some of the states that have enacted that, I've identified here, Illinois, Iowa, Minnesota as examples. And by doing that, radon testing has increased in all of those states quite significantly, and that has led to increased radon mitigation, which means lower radon exposure and lives saved by doing that. Also, a number of states, nearly 20 in the US, have enacted licensing requirements for professionals doing radon measurement and professionals doing radon mitigation. And that helps ensure the quality of both testing and mitigation. And in fact, it's absolutely imperative that if professionals are hired to do measurement, that they be nationally certified and or state licensed, because the quality of the test is no better than the professional doing them. For new construction, we can incorporate in building codes some very simple steps that do not add more than $1,000 to the cost of most new houses and can have an important impact on reducing radon exposure. Properly installed, these systems can reduce indoor radon concentrations about 50% and also make it easy if further reduction is desired to install a fan for a few $100s. We also have the importance of taking care of our children, and that begins with in child care facilities. A number of states have testing and perhaps mitigation requirements, at least disclosure to parents. And then it's important for us to also be concerned about others who live in rental housing, just not for sale property. And so that's another area that's important to look at policy actions. Radon resources are available from state radon programs, the American Lung Association, the Environmental Protection Agency, and the Center for Disease Control and Prevention. So thank you for letting me share a few moments, and if you have questions later on, I'll be happy to do whatever I can to answer those. Thank you.
I was introduced. Bailey, can you hear me?
Yes.
Okay. Thank you for the great information, William. That was really informative. I know I learned a lot as well. We have a poll to start off with before we get started. If you as a participant could take a quick second and answer how confident you are talking to home buyers and sellers about radon. We'll give you a second and then we'll come back to talk about the results and a little bit more. All right. Looks like some answers are coming in. We're pretty spread across the board. It looks like a third of you are extremely knowledgeable, a third are very knowledgeable, and we have some not very knowledgeables as well. So hopefully you'll find this overview of radon in a typical real estate transaction helpful and a good review. Let's jump on in. For those of you who may not know, here's the process. Here's the process for radon in a typical real estate transaction. First, the home buyer submits an offer. Second, the home seller accepts the offer, and in some states, the seller is required to disclose if they have tested for radon, the results of any testing that has been conducted, and if a mitigation system is installed in the home as well. Next up, typically a home buyer would order a home inspection if applicable. And if the home you're buying already has a mitigation system installed, it's a good idea to conduct a radon test and system maintenance inspection to ensure that the system is still working to keep the radon levels down in the home. Some states require disclosure of radon, and it's a best practice if they do to have completed that system maintenance prior to the home being actively marketed. If the home you're buying does not have a radon mitigation system installed, if the radon test comes back elevated, you'll want to have the system installed to reduce your risk of exposure. The sellers of the home may have already tested for radon in the past, which they would have hopefully disclosed if necessary. And depending on the state that you live in, the home seller could be legally obligated, excuse me, to disclose the radon levels of the home from their last test. However, radon levels can fluctuate, as we just heard, due to weather, seasonal change, or home renovations, so it's still advisable to perform another radon test during the home inspection. In fact, homes with radon mitigation systems should be tested every 2 years as a best practice to confirm that radon concentrations remain below the action level. The next step in the real estate transaction, or what we consider, is that the contract is considered contingent upon the inspections. A radon test should be conducted during the inspection period, and for real estate transactions, the real estate test is conducted during that inspection period. Most home inspectors offer a professional radon test as an additional service. The radon test expense is most often covered by the home buyer along with the inspection. And I know customarily that having a radon included in your inspection period, I think is becoming more and more popular. The radon test results are then provided to whomever purchased the radon test, and depending on the results, the buyer may request for seller to provide a mitigation system as necessary. Next, let's discuss the risks of both home selling and home buying a home with high radon levels. First, we'll talk about selling a home with high radon levels. Here are a few risks to selling a home. Not accommodating a radon mitigation system can risk the sales contract falling through. A mitigation system presents an unwanted additional expense. The cost can vary by state and by home size. Typically, we see the cost range between $1,200 and $2,500. Liability of installing the cheapest system before closing may not protect the buyer long term if a faulty system is installed, which could also cause post-closing issues, which we never want. Next, let's look at buying a home with high radon levels. Here are some risks. The combination of high radon levels and no mitigation system puts people at risk of radon exposure. A mitigation system presents an unwanted but necessary additional expense to be considered when purchasing the home, as we said, typically between $1,200 and $2,500 depending on the size. And if a mitigation system is installed or was previously, ensuring the system continues to operate correctly long term is paramount. Here are a few tips to use when talking with your clients about radon mitigation. It's important to know what the risks are in the real estate transaction and how to advise your clients best and most safely. When considering who should pay for the radon mitigation system in your real estate transaction, it's recommended for the buyer and the seller to negotiate a fair allowance to be made for the mitigation system to be installed or repaired and maintained appropriately. Subsequently, this solution highly benefits both home sellers and home buyers alike and keeps the transaction moving forward on schedule, keeping in mind everyone's shared goal to successfully transfer home ownership from the seller to buyer at the closing. How to protect yourself and clients. There's many ways to do this, and the first and foremost is know your state radon program. The second, which you're doing today by being on the webinar, is educate yourself about radon. I don't think you need to be an expert in all things radon, but I think it's very important to arm yourself with knowledge and resources that you can make available to your clients as well as needed to have them further their research and have a comfort level of the home they're buying or selling. Next, you want to develop and follow written radon policies in your office, especially if you're an office manager or broker owner. It's really important to have guidelines around this to protect yourself as a brokerage, but also offer best-in-class service to your agents and their clients. It's very important not to interfere with testing procedures or mitigation systems of certified contractors. And lastly, know your state disclosure laws regarding testing, notification, and disclosure. There's a great website that's available nationwide, epa.gov/radon. It's a comprehensive website where lots of details can be found. There's a radon zone map of the U.S., which I found very helpful and have referred to many times with clients, especially if they're moving outside of the area that you're most comfortable having experience and knowledge in. It's a great resource. There's a section also on laws and regulations broken down by state and territory, along with a list of many of the health and environmental agencies within each state. You can also find information on environmental topics such as radon and many, many more that are effective and prevalent in your area. Remember, January is Radon Action Month, and I know I, as one real estate professional to another, really appreciate you all raising the bar and the level of professionals in your area to be further educated about radon. Thanks for educating yourself today on the effects of radon that you support and how to support your clients and be able to best serve them through their homeownership journeys. Thanks so much. This concludes my section, and I will pass it back and answer questions later as they come. Thank you.
Okay. I wanted to wrap things up today with just some things that I hope you take away from today. Living with lung cancer is all about hope. So these are some of the things that I hope for you today. I hope you now feel different about radon because you have seen and heard from someone who has lung cancer. I'm so thankful the American Lung Association chose to include a lung cancer survivor in this conversation today about radon. They also made the decision to change the format of this webinar to allow me the opportunity to open and close our discussion today, and I don't take that lightly. When you talk about radon and how it relates to lung cancer, you're talking about the lives of people. There are thousands of us across the U.S. whose worlds are turned upside down because of how this disease storms unexpectedly into our lives. Unless you see us, hear us, and believe because of our stories that this disease can infiltrate the lives of your clients, your loved ones, and yourself, I don't believe attitudes towards radon will change. You now feel you know enough about radon and the dangers it can pose to homeowners. I know you've probably listened to presentations on radon before, but after today, I hope you continue to seek the information necessary to help have a positive impact on your clients when it comes to testing for radon. I hope you see it as something more than just a box to check off on some paperwork. You are motivated to tell your colleagues more about radon. I challenged the American Lung Association to not just talk about us or with us, but to allow someone who has lived through this diagnosis to have a chance to tell their story, their journey, and their perspective about radon-induced lung cancer. And they accepted without hesitation. I hope after today you want to hear more from us and you want to tell those you work with in your profession about how today has impacted you personally. You hope to see the subject of radon and the dangers it poses to homeowners talked about more in your profession. Finally, I just challenge each of you, if you have the opportunity, to include us in your education of the subject with your colleagues and your continuing education platforms, to please do so. Sadly, so many lung cancer survivors are diagnosed at stage 4, and their health does not always allow them opportunities to advocate proactively about lung cancer because they are immediately thrust into having to react to health issues that are brought on so quickly after they're diagnosed. We must depend on larger platforms to elevate our message. I hope you feel it's your obligation to take this challenge on. As I mentioned earlier, there's so few things we can do to help in the prevention of lung cancer, but radon testing and mitigation is something we can all do to help prevent lung cancer. Thank you all for your time and attention today.
Catherine, I think you may be muted.
I'm muted. Oh, great. Okay. Well, you missed my great introduction, and my very sincere thanks to our speakers for sharing their stories and their information. And we'll go on to the Q&A. If you have questions that you haven't put in the Q&A box, please do. We have about 10 minutes, and we'll get to as many of them as we can. First question for Professor Angel: is a short-term 2 to 4 day radon test okay for real estate transactions, considering the wide swings in radon level depending on the time of year and weather conditions?
The short answer is yes, and usually the time constraints dictate that short-term measurements such as 2 to 4 days are done. From a scientific standpoint, we would always like the longest term measurements possible. And I like to point out it's not an or question, it's an and question. In fact, my father-in-law, after he built a new home, asked, what's the ideal way to test it? And my recommendation to him was test it both short-term and long-term. The advantage of a short-term measurement is you have some sense whether you may have a very high exposure that you need to act upon more quickly. And so I think it's a question of not or, but both. Thank you.
Thank you. Another question or an observation, but I think one that's worth responding to. Slabs are not as widely tested as homes with basement areas, which would not be what we would recommend, correct?
That's correct. Any home, irregardless of the type of foundation, can have elevated indoor radon. Florida, for example, has quite a long history of parts of that state being elevated with radon, and that's primarily slab-on-grade foundations. My own state, as you might be able to tell by my dress, Minnesota, very cold. We are dominated by basements. We have radon. So it doesn't matter the type of foundation. All homes should be tested.
A related question: a radon test should be performed at what level of the house?
You want to test the level you're living in if you're testing your own home. For real estate guidance, it's the lowest level that could be lived in. And it doesn't have to be finished. I've been in many houses, and I think Lindy referenced the home that she grew up in. If the basement's unfinished, it still may be used for living purposes. So it's any level that could be used for living purposes in a real estate type of transaction.
Thank you. Let's see. Here's a question. Oops, I just lost it. A question for Stacy, probably. How do I get in touch with state real estate associations?
Hi, I would contact your state association. In Kentucky, it's the Kentucky Real Estate Association. I would go through them if you have specific questions.
Yeah, this is coming from someone in a radon program. So they would like to work with their state real estate association.
I would start at the state, and if you are in a large city, you might also go through, if there's a local real estate board that might be helpful for your region as well.
Okay, let's see. For Lindy, I've read that diagnosis of lung cancer is generally in the later stages. Should early detection of lung cancer be critical in high radon areas?
Well, it should. Right now, the only people who can even be screened for radon are those who are considered high risk, which is if you fall within a certain amount of smoking history. So we certainly would love to see people who feel like they are in areas that have high levels of radon, or they grew up around secondhand smoke, that this does start to come into the equation for who can get tested, because right now, the majority of people who aren't considered high risk, really their symptoms are not perceived at all as something that could be lung cancer, especially if they're on the younger spectrum. And therefore, by the time symptoms really show up, sadly, it is already stage 4. Mine was just a complete incidental finding, and that's really the only reason they were able to find it fairly early.
Right, thank you. Should we, as real estate practitioners, recommend mitigation at 2.7 picocuries per liter? I think that's probably a question for Professor Angel. Is that something you can respond to?
I'm sorry, I was reading questions.
Okay. Should we, as real estate practitioners, recommend mitigation at 2.7 picocuries per liter?
In my opinion, yes. The health evidence is very strong, and any reduction is going to be helpful, but as a policy, a 2.7 action level would be recommended, and even to attempt to get radon concentrations below that, as low as reasonably possible, and within economic boundaries, of course. 2.7 is reasonable, in my opinion.
Couple of other sort of related questions here about that include sort of the incentivizing homeowners to pay for mitigation. The first question is states that radon remediation companies will guarantee to bring the radon level down to 4 picocuries per liter. So if a home measures 2 or 2.7 and the homeowner pays $1,000 for remediation, it might not change, correct?
I'm not sure that let me try to answer that question as I understand it. And that is, radon mitigation professionals will guarantee different levels, and in part that's influenced by the market, almost always below 4, although some will not guarantee any. So you have to look at that in estimates. The real pros that I know will offer below 2 picocuries per liter. There may be some limitations in some markets where you have very high outdoor concentrations, but those tend to be the exceptions. So below 2 is common, as low as reasonably achievable within, again, economic boundaries. I think would be important to consider at least.
Great, thank you. I think, and maybe we just have time for 1 or 2 more questions. Maybe this is a question for Stacy from your experience, or maybe it's a question for Professor Angel. How do I convince a client with a 2-something picocuries per liter to pay over $1,000 when there's no guarantee that the level will be reduced?
From my perspective, I typically would not advise a real estate agent to convince anyone of anything. I think it's our job to offer the information, offer the resources, we advise, and ultimately they decide. I think there are things in the real estate industry that we do tracking-wise to show that we've offered a variety of inspections or other home ownership items that we think are important, but I don't think it's up to us in our profession to convince anyone. I think Dr. William would be the best convincer, and Lindy, but I would be prepared to offer them the resources and then ultimately let them decide.
And I concur. I think that's a great answer. I'll just point out that there is a major health risk at 4 picocuries per liter, and again, I would shoot to get under 2.7, and if I have a mitigator that it's not going to charge me a lot to go under 2. That's what I would shoot for, as low as reasonably achievable.
Okay, one more thing that we haven't touched on. I'm going to make it our last question, and then we will have to say farewell for today is can you talk about whether whether it's just as good to buy a test kit locally and do your own test as opposed to hiring someone when you're in a real estate transaction?
Well, let me take a beginning with that, and that is, and I'll overstate it, but any test is better than no test. Uh, Personally, I would prefer to purchase a radon measurement device if I'm buying one to test my own home directly from the analytical laboratory. And your state radon programs can point you in the right direction. Um, for a real estate transaction, an independent third party, in other words, hiring a pro to do the testing, I think is very important to do.
Okay, well, that takes us right to time. Thank you so much again to our three great speakers for sharing your time and your wisdom with us. And thanks to all our participants. Please remember to complete the evaluation, which you will see as soon as we close out this webinar. If you complete the evaluation, you'll receive a certificate of attendance. Please promote radon awareness, especially in those of you who deal with home buyers and sellers. It's such a critical moment and opportunity. And to learn more about radon, you can always go to lung.org/radon. Thank you.